1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Anagha, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
So, women who have polycystic ovaries, we observe that almost 40 to 60% of those women are obese or overweight. So all these women have to remember that their guns are already loaded with their genes, but the trigger is in their hand by managing their lifestyle. So having a good balanced diet can help them a long way. So these women we advise to increase the protein content of their diet, which increases their satiety and it helps them to lose weight. We ask them to eat local food, less processed food. We call it as farm to fork. So as less processing as possible. Third thing is they should also control their portion size. And all these strategies can manage their weight, reduce their weight and maintain the weight, which goes a long way in maintaining their hormonal profile, the insulin resistance, and all the side effects that come along the way.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
Yeah, thank you Sania for that question. It is very much relevant for all the women who have PCOS to stay physically active because they have weight issues and all the parameters, the metabolic problems that they have are linked to it. So studies have shown that just a moderate intensity exercise which can achieve around 10% of weight loss. Suppose if they are 70 kg and they lose around 7 to 8 kgs of their current weight, it is going to help them to control the testosterone levels, to control the insulin levels. It improves their ovulatory function, improves their fertility and all the metabolic diseases that they are likely to have. So they should invest time at least of around 20 to 40 minutes of moderate intensity exercise. It could be brisk walking, Zumba, it could be cardio in the gym, cycling, swimming, any form of exercise which they like.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
Sania, it's very important for women with PCOS to remember that it's an ongoing disease. It's going to affect them throughout their adolescence and their adulthood and of course till they reach and after their menopause also. So they need to be under monitoring. They need to control this, I wouldn't call disease, but a condition by regular lifestyle changes and regularly being checked. So first and foremost, we will monitor their weight and body mass index. They need to monitor their sugar levels and insulin levels, blood pressures. They are at higher risk of developing diabetes during pregnancy. So if we can detect it by a simple test called as glucose tolerance test, we can treat them in time. They also need to monitor their ovulatory parameters because that indicates how the hormonal profile is going on in their body, because they are at a higher risk of developing cancers. As you know, the uterine cancer, the breast cancers are much higher in women with PCOS. They are at much higher risk of developing high blood pressures, diabetes and cardiovascular events. So their lipid profiles, their sugars and blood pressures and cardiovascular parameters also needs to be monitored throughout their life.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Anagha, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.